If it wasn't for Doc Lyons and Donatelli, I'd be dead. My name's Troy Mazer. I live in Warren, Ohio, and I was a carpenter. And first I started out landscaping, and I was a carpenter.
Troy came to me as a new patient, presumably to be evaluated regarding complaints of abdominal and left groin pain. He'd had some inguinal hernia surgeries in the past that didn't go so well. When Troy walked into my office the first day, his morphine equivalent dose was 600 milligrams per day. He started me out on Darvocet, and progressively I went from Darvocet to Percodan, Percocet, Vicodin, on all the way up to Oxycontin and Roxycontin, Clozapine. I mean, you name it, I've probably been on it.
When I first got Troy in my care, he was obviously in a lot of pain at the time. He was taking an excessive amount of pain medication. He definitely needed to be in some type of pain management program, and I deal with many pain doctors. I had made the referral to Dr. Donatelli's office, and Dr. Donatelli needed him to go through a drug detox program prior to even being considered for any type of pain management.
If it wasn't for Doc Lyons and Donatelli, I'd be dead.
How many years were you, from when the first hernia to the point you met Dr. Lyons, how many years was that?
About 15 to 17 years.
Yeah. Wow.
Yeah.
And you progressed from nothing to 600 morphine equivalent milligrams a day.
Yeah.
I think the keys to success here can be applied to the bigger picture, and that is, very rarely does a person who has a chronic pain syndrome find a solution that comes in any one form.
Agreed.
If you ask the doctor how far from where I am to where I am now,
Right.
It's a night and day.
Right.
Like now, I can walk my dogs. I go out to the store. I wouldn't go to the store because I don't want to walk around. I was hurting too bad.
Right.
At least now I know I'm gonna have pain the rest of my life. It's at a manageable level where I can go out and do things. You know, I ain't running 5 miles or swimming or anything like that, but
I'm not either, so we're in good shape.
In 2014, Ohio Governor John Kasich commissioned the Governor's Cabinet Opiate Action Team to create a new and innovative program to fix the opioid abuse and problems in Ohio. After 2 years of research, discussion, and collaboration from all major stakeholders, it became apparent and all agreed that non-pharmacological therapies should be considered as first-line therapy for acute pain unless the natural history of the cause of pain or clinical judgment warrants a different approach. As a state, as policymakers, it's time to put the state's own recommendation into action and help the struggling citizens in our communities. If you or your office would like more information about decreasing drug abuse addiction and overdoses, lowering the cost of health care, and improving the lives of your citizens, then please contact the Ohio State Chiropractic Association and Nicholas Strada at 614-229-5290 or Nicholas at oscachiro.org.